I think you'd probably want to take a structured approach to that, so a phased approach. My advice would be you don't necessarily need to jump straight into a merger. I know how difficult and complicated that is. I think there are some quick wins with working at scale. So certainly you can start sharing some functions such as your HR functions. I mean, we have an HR company that we contract with to provide us HR support and legal cover. We have a director whose only role is HR and contracts. It'd be quite easy to create that role and function across multiple practices where you have a single HR function across. You maybe even have one person responsible for HR across a number of different sites, and certainly some of the contracting and payroll management, for example, can be done across. You'll save cost, but also you'll probably do it better. And I think individual practice managers have such a broad burden of responsibility and so much pressure on them to start to carve out that role and to say we don't expect one person to be a superman or woman. And let's be realistic about what you can do, and let's make sure that what you are doing you do really well. I think there are some things that you could easily do across multiple sites. The finance function is probably one that lends itself as well. So we've got a single director of finance and IT. I think a lot of practices struggle with proactively managing their finances. A lot of the time it's you kind of see what comes in and try and manage your outgoings so that it roughly balances. What we're able to do with having someone who's dedicated to pretty much just looking at finance is to plan much more effectively, so to do forecasts, to start budgeting for the coming financial year well in advance of the start of the year, and that allows you to plan your recruitment as well, and your because the biggest cost we have as practices is our staff cost, and trying to get the right balance between the amount you're spending on your staff and the amount you come in is really difficult actually. It's a difficult juggling act. So to have a proper finance function, that's something you could do at scale, because you could have a finance person who understands practice finances and could do that function across multiple sites, I think. Another obvious one that you could do across multiple sites is the staff training and development. And I know the CEPN is doing a bit of that, but I don't think you can rely on the CEPN for all your staff training and development, and actually there's various bits of training you can do across multiple sites. You can also have an oversight function where you're tracking your individual staff mandatory training needs and learning and development needs, and what you'll find across multiple sites is you have groups of staff who all need the same stuff, and it'll be much more effective to do it once across rather than each practice trying to source their own training. I guess the next step is thinking about really starting to work together at scale. The elephant in the room with general practice is we're all competing for the same group of patients. So for general practice, your income is your patients. I mean, okay, there's sources of private income, but they're pretty small. And there's enhanced services, it's a pretty small part. Your core income is the number of patients you have. So when practices talk about collaborating with each other, behind that, a lot of practices are still thinking, but hang on, am I going to lose patients to this other practice? We have to get through that if we want to work effectively together. I don't think it's the right thing for us to continue competing with each other as small organisations. We have to find a way to break through that. At some point that involves having proper conversations about the money and how you sort that out. Either it's through a really clever alliance agreement where you all look at your cost base and your income and you come up with a sensible agreement about how you manage that, or you bring the organisations together and you essentially merge their budgets. And I think they're both viable. It's possible to do both.